have a look at this clinical question. Okay, so I thought I'd give you a slightly easier one for the last one in the set. Nearly everyone's got this one right, so that's great. So this lady, 52, got both vasomotor symptoms, but also sometimes people will have vaginal symptoms. And this is the key, that the fact she's had no period for 14 months, i.e. it's been more than 12 months, otherwise well, not taking medication, not on any contraception, then that's enough for us to clinically diagnose menopause. We don't need to do any testing, okay? And testing isn't recommended if someone has not had periods for this long with this type of history. So let's look at what the guideline recommends in terms of who we can diagnose without testing, who we might do tests, and what kind of tests, okay? So you can diagnose perimenopause without testing if someone's 45 or more, and you'll sometimes see this in exam settings, that if there's a threshold, they'll set the patient right at that threshold or very close to it to test if you know the guideline. So 45 or more, and they've got vasomotor symptoms, and they've got some changes in menstrual cycle, like periods becoming irregular. Now, it could be that they become less regular or more regular. It can happen either way, okay? So changes in the cycle. And then you can diagnose menopause rather than perimenopause without testing if they've already had a hysterectomy and they've got menopausal symptoms. Because if they've had a hysterectomy, you know, the periods aren't there, the bleeding isn't a symptom that we can rely on. So we just look at having menopausal symptoms. Or they're 45 and over and they've had no periods at all for 12 months, not irregular periods or light periods. That's not quite enough for them to, but have no periods at all for 12 months. And they're not using any hormonal contraception. That's because if they're still using hormonal contraception, that can cause that amenorrhea, especially, for example, can anyone think of something that someone might be using as a long-term contraception? They've completed their family around this age group, that will often lead to them having no periods at all. And so therefore couldn't rely on, the intrauterine systems, the Mirena coil, okay? Out of interest, as a side point of learning, you know, we often see patients who are on the Mirena coil, have got one in situ. What's the recently updated period that you can use that for? What's the license? It was recently updated. Anyone know? How many years? Great. So most people are aware that it's now 8 years. Used to be 5, with a proviso that if they couldn't get a date for have it removed, it could be used up to 6. Then it was changed to license to be 6. Now it's up to 8 years. Okay. Okay, and then thinking about some of the other things to be aware of, because there might be certain patients or patient groups where you need to tailor how you approach the history taking. That you often see a lower age onset of both perimenopause and menopause in certain patients if they've had family history of there being early menopause or perimenopause, certain ethnic groups, but also some chronic conditions that can lead to changes happening earlier. In terms of testing, what does NICE say? Specifically, they said that you should not test with FSH if they're using hormonal contraception. You shouldn't use AMH, anti-Mullerian hormone, estradiol, inhibin, A or B, ovarian volume, or follicle count. Okay. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.